Hi everybody. So what I'm going to do is I'm going to make a little video to go over the practice quizzes. Because there's two groups and one group doesn't have to take herbs this semester, I'll do herbs separately. So I'll go through all of the practice quizzes, 1 through 3, do all of the subjects, skip herbs, and then do a separate video where I do herbs for test 1 through 3. And the reason for that is just so the other group doesn't have to kind of sit through the herbs part when right now that's not going to be their focus. Maybe next semester it will be. So anyway, the way I'll do this is you already have the answers to the practice quizzes. This is just meant to serve as a review because, we only have 7 weeks to essentially go over everything that you've learned in over a year of school. And certainly because of that, we have to go through some things relatively quickly. There may be things that you wrote down the first week of class, and now you're looking back at your notes and you're not really clear on exactly what you wrote, whatever it may be. So this will be a way to kind of get a final summary. And it's a final summary in a version that you can kind of re-watch again and again if need be. So without further ado, test 1. Which of the following is most yin? Blood, exterior, sun, or movement? So the answer here is, of course, blood. And the reason for that is, in terms of yin versus yang, remember that yin applies to things that are more dark, internal, substantive, still, on the cooler side of things. And that includes things like blood, which is an internal substance inside of your body, versus yang, which is more outside, warm, energetic, bright, exterior. Sorry, I think I might have said that already. Up higher. And that would include things, so in terms of things that are more yang, that would include things like the other choices, exterior, sun, movement, and it would include things like qi, which is more energetic, particularly wei qi, which is the qi that's on the most outside of our body. So just keep those differences in mind. If you apply those differences, you'll get most questions in regard to yin versus yang. And of course, remember that the two, they call it an interdependent relationship. They're both necessary. They balance each other out. If you get too much yin, it winds up kind of dampening out the yang. If you get too much fluid accumulation, it winds up causing your qi to stagnate, for example. Or if you wind up getting spleen qi deficiency, it winds up leading to accumulation of dampness. So essentially, not enough yang leads to accumulation of yin. Accumulation of yin leads to the stagnation of yang. So the two, you need both. They're interdependent. If one goes away, the other kind of accumulates and leads to pathology. If one accumulates, it winds up dampening out the other, leading to pathology. So just keep all of that in mind and you'll get most questions regarding this topic. Okay, number 2, what element should be tonified if earth was in excess? So remember that in cases of excess, you always tonify the grandmother, the controller. So in this case, since earth is in excess, you want to tonify wood, which wood is the controller. Remember, the grandmother is always 2 generations back. And that's who you'd want to tonify if there was an excess condition. Remember, if there's a deficiency condition, you always want to tonify the mother. So for example, if this said, if earth was deficient, who would you tonify? You would wind up tonifying fire. So do make sure that you look at your 5-element chart that I gave you in class. Make sure that you know the general order, that it's wood, fire, earth, metal, water. Make sure that you know that. And make sure that you, of course, know the relationships that, let's say we're talking about earth, for example, like we are here. If you go 1 generation back, that's the mother. 2 generations back, that's the grandmother. So that, therefore, fire's the mother, wood's the grandmother. And if you go 1 generation forward, that's the child. So as far as this topic goes, make sure that you know everything associated with the 5 elements in the sense of make sure you know what colors go with what temperature or what weather patterns, what body part, for example, like the sinews and tendons go with wood. Make sure you know stuff like that. And then make sure you know some of the pathological relationships that exist. So remember that it's normal for wood to control earth, for the grandmother to control the grandchild. That's normal. It's a normal relationship. Wood keeps earth kind of in check. But remember that sometimes you can get situations where you over-control. So wood over-controls earth. And usually the way that will present is there'll be some type of symptoms, like they'll talk about the person having a lot of stress and a wiry pulse and irritability. And, in other words, they're saying liver qi stagnation, an excess liver pattern. And at the same time, they're getting low appetite, loose stool, diarrhea. And that's kind of hinting at, oh, okay, that's this wood-earth relationship. And this is clearly a pathology. So the normal wood-earth relationship is for wood to control earth. Since this clearly is a pathology, what must be happening is wood is over-controlling earth. You can get situations where a deficient organ fails to control, or let's say a deficient element. A deficient element fails to control its controllee. So, for example, we've all heard of the pattern heart and kidney not communicating. So, let's say you have kidney yin deficiency. That can lead to the kidney being unable to control the heart, or you can say water being unable to control fire. And then you wind up getting symptoms like irritability, insomnia, palpitations, tossing and turning, all of that kind of stuff. So if somebody clearly has some kidney insufficiency symptoms, and then on top of it they're starting to get these heart symptoms, that might be a relationship to explain. Now, keep in mind, they're always pretty clear about, like, they're not going to mix and match things like wood insulting earth with kidney yin and then put kidney yin deficiency as a choice. Like, they're usually can be pretty consistent, where if they're asking about this subject matter, all the choices will be something having to do with element relationships. And then it's just a matter of kind of figuring out which one makes the most sense here. So it's like, again, if you see clearly heart and kidney symptoms, just think, well, the normal relationship between heart and kidney is that it's water controls fire. This is a disease. What seems to be happening here? And then do remember the possibility of insulting. Now, again, there's ones that typically come up and ones that don't. Like, you don't hear, for example, about, let's see, what would be a good example? You don't hear too much like earth insulting wood. Usually wood is the more dominant of the organs or channels or elements, and earth is the more kind of passive of the two. But, for example, you do tend to hear about wood insulting metal, because, again, the liver, control freak, right? I mean, the general of the body, control freak. So metal tries to control wood, and you do get situations where, again, take a person that's very stressed out, wiry pulse, irritable, high blood pressure, throbbing headache, that kind of stuff, and then they develop a cough. That would be an example of wood insulting metal. Metal's supposed to control wood, and it's insulting in this case. So just a little offshoot there. Okay, number 3, what pathogenic factor is most likely to cause itching, tremors, and spasms? So that would be wind, because itching, the idea is it moves around, like you feel like kind of a movement, some feeling of something crawling on your skin that makes you scratch. So that is said to be a wind thing. And tremors and spasms, remember, that's internal wind. Where, think about TCM, how they would think about this. The body is shaking. There must be wind in your body. As far as some of the other ones, fire, of course, that's not even close. That would lead to heat signs. It would lead to redness. It would lead to manic behavior. It would lead to swelling. Think inflammation symptoms. Dampness, we know, it leads to like heaviness and distension and fullness, and greasy tongue coating and things like that. And cold, is of course characterized by not only just obviously cold temperature, but it's characterized by, generally it leads to stagnation. So you get a lot of like fixed localized pain, because cold will often lead to stagnation. What organ governs the bones? That's of course kidney. And you have handouts that tell you some of these other things, but of course, to go to the other answers, liver governs the sinews and the tendons, spleen, and some books say the sinews and the nerves. So in other words, anything kind of sinewy and stringy in the body. The spleen is said to govern the flesh and the muscles. The lung is said to govern the skin. And then, of course, the heart is said to govern the vessels. That's not a choice here, but the heart is said to govern the vessels. Number 5, which of the following all correspond to the heart? So here's a good example of how they do some of these questions. There's a number of questions like this where you really need to know all the things that go with heart, all the things that go with liver, etc. Because otherwise, it's very easy to get a question like this and kind of know which one it looks like it is. But at the same time, if you're even off on like kind of one of the things, you can see how that can cause you to be off here. So, choice A, so in terms of corresponding to the heart, summer works, but east, sinews, that corresponds more to the liver. C, south looks good, but acrid, that corresponds to the lung and metal. Hoon corresponds to wood and liver. And choice D, joy looks good, tongue looks good, but putrid, that's the smell of the kidney. So, again, some good examples of ones where you really have to kind of know these pretty well, because each choice is going to probably have something that's correct, but it won't be totally correct. Alright, so number 6, what type of qi relates to the heartbeat and the strength of the voice? That's the zong qi. So definitely do know the types of qis. So remember, the wei qi is the most exterior. It's the one that's basically said to be found between the skin and the muscles. It's on the exterior of the body. It creates some defense against pathogens. Zong qi is, remember, when the air qi and the food qi combine in the chest. And then that leads to a type of qi that's located in the chest and plays a role in your heartbeat and strength of voice and all of that stuff. Zong qi with an H refers to, I usually think H for hunger, because zong qi with an H relates to your middle jiao qi. And original qi is mostly associated with the kidneys. Essentially it's the qi that you come into this world with. You can think of it as, to some extent, your constitutional qi. What kind of gives you your overall constitutional strength. And then remember a couple other qis that tend to come up. Your gu qi, Gu. That's the one that the spleen, that's basically the qi of food and grain, or water and grain, that the spleen extracts from what you eat, sends up to the lungs, combines with the air qi, and then creates the zong qi. And then also remember there's the nutritive qi, or the yin qi, and this is like said to be the qi of the blood. In fact, in terms of qis, this is the most yin of the qis, whereas wei qi is the most yang because it's on the exterior. The yin qi is found in the blood, and it's sort of the energetic aspect of the blood. So it's kind of the most substantive of the qis and the energetic aspect of the blood. So those are some of the other types of qis that will tend to come up here, just as a quick reminder. Then what organ is responsible for rotting and ripening of food? So that, of course, is the stomach, and definitely knows some of those relationships pretty well. Like the spleen, for example, is for transportation and transformation of the food that you eat. The large intestine, remember, is conveyance and conductance. Basically, it takes all the remaining waste products that you've eaten and helps conduct them out of the body. And of course, the small intestine, remember, separates the clear from the turbid. Number 8, what pulse would you expect for a person with yin deficiency? So pulses and tongues come up a lot. So remember, yin deficiency is going to be a thin pulse because they are deficient. Remember, yin is a substance. So a deficiency of yin affects more the size of the pulse, not the strength. Now, it wouldn't necessarily be totally wrong if they also put the word weak in there. Of course, if it's a case, keep the whole picture in mind. But generally speaking, yin is a substance, so it affects the size of the pulse, so thin. And of course, yin deficiency creates heat, so thin and rapid. As far as some of these other pulses go, and I will mention one other thing regarding yin deficiency. Do remember that sometimes a yin deficiency pulse can be said to be floating, because yin wants to go deep, yang wants to go to the surface. So if you're yin deficient, the pulse kind of comes closer to the surface because it's not being anchored. So they could sometimes say that, and you might think, oh no, what if I confuse it with wind heat or wind cold? But remember, I mean, the symptoms are so different, you would never confuse it. I mean, if somebody has fever and chills and body aches and cough and sneezing with a floating pulse, well, clearly that's a wind heat or wind cold invasion. But if somebody has night sweats, 5 center heat, malar flush, and they describe the pulse as being floating, well, clearly that's yin deficiency. So, obviously they can't ask you a question like person has a floating pulse and just give you that and then put yin deficiency or wind heat both as a choice. So they would not do something like that. Choice B, weak. Generally weak just means qi deficiency, but not enough energy to create a strong pulse. C, slippery and rapid. Well, slippery generally means damp or phlegm. And rapid, of course, means heat, so this generally would mean damp heat or phlegm heat. And wiry, remember, can mean a lot of things. So wiry, you'll often see wiry for anything involving the liver or gallbladder, anything related to the wood element. So it could be liver yang rising, it could be liver qi stagnation. You'll also see it involved with just any type of qi stagnation. They could put wiry pulse. Because remember, the liver is responsible for the free coursing of qi. So any qi stagnation, even if you don't specify liver qi stagnation, could affect the liver and therefore give you a wiry pulse. And remember that anything involving pain, you can see a wiry pulse. And also remember, if you get something about Xiaoyang disorder, the one where you have alternating fever and chills, Xiaoyang, that involves the gallbladder channel, so that can have a wiry pulse. Anything involving stress can have a wiry pulse. So there's a lot of things with wiry. And one other thing a synonym I meant to mention is for choice A, thin. If you see the term thready, remember a piece of thread is thin, right? So thready generally implies a thin pulse. Okay, what tongue would you expect for a person with stomach fire? Well, stomach fire obviously is a heat condition. Stomach fire is excess heat because it doesn't say anything about yin deficiency or anything. So that would be choice D, red with a thick, dry coat. Now, as far as the thickness part, this sometimes confuses people. Sometimes people see thick coat and they automatically think, oh, that's dampness. Now, this says a thick, dry coat, so clearly that's not dampness. But remember, just saying a thick coat just means excess. So red with a thick yellow coat. And actually, sorry, I misread choice D. It says red with a thick dry coat. That's still the answer. But even if I had said red with a thick yellow coat, thick just means excess. It doesn't necessarily mean dampness. In order to see dampness or phlegm, it's got to say something about sticky, greasy, slimy, something like that. Just seeing thick just means excess condition, so that's why that is the answer. Choice A, red with a thick, greasy coat, so that would be phlegm heat or damp heat. Purple, of course, is blood stagnation, and then pale with teeth marks, that is, of course, pale in and of itself can mean qi or blood deficiency. With teeth marks, usually that means spleen qi deficiency. And then as far as the treatment principle for Xiaoyang disorder, it's harmonizing. Harmonize the Xiaoyang. So that's a good example of one where, when you say it, like, oh, harmonize the Xiaoyang, it's like, that sounds familiar, it sounds reasonable. But it's very easy for people to go, well, Xiaoyang disorder, I mean, I guess you could promote sweating, I guess you could clear heat, so these are ones where, it's not that it's hard, but it's just, sometimes the terminology is stuff that you don't hear or use a lot. So choice A, sweating, that's of course for external attacks. So somebody with fever, chills, floating pulse, that's where you would sweat. Purging is of course for internal excess, usually heat. Clearing heat is obviously for heat, so it's very simple. If somebody just has a qi level heat, let's say, you would clear heat. If they have heat, in their bowels or something, that's where you might purge. And then, just to mention a few others, obviously if somebody has deficiency, deficient qi, deficient blood, that's where you would kind of supplement or nourish. If somebody has liver qi stagnation, One of the treatment principles, that it sounds so general, nobody picks it, but one of the treatment principles is just soothe the liver. So I think what I'm going to do here is, rather than jump all over the place, I'm going to do all of the OM sections. So I'll go to quiz 2, and I'll just do that for everything now. I'll just do all the sections together. Just so, because there's some things where they overlap, so I'll just say, oh, we already talked about it and stuff. So going to quiz 2, the OM section, which of the following most relates to wind? So the wood element relates to wind, and this is just 5-element association. So metal relates to dryness, water relates to cold, wood relates to damp, and fire relates to heat. So this is just a relation between weather, the type of weather that's out there, and what element it goes with. Number 2, illnesses that are worse with activity are indicative of which disorder? So that's Qi deficiency. So whenever you see it with any condition, if they specify whatever it might be, a fever that gets worse when they're active, Qi deficiency. Whenever it's worse with activity, think Qi deficiency. Whenever it's better with activity, think choice B, Qi stagnation. That's something that sometimes people have a little trouble wrapping their mind around. They miss kind of simple answers where somebody comes in with fatigue and they just automatically think it has to be deficiency. But if they ever specify in a case study here that somebody has fatigue, but it's better when they exercise, it's better when they do yoga, it's better when they move, that means it's probably a Qi stagnation pattern. Qi stagnation can lead to fatigue. Think about when you're sitting in class for 3 hours. Sometimes you're fatigued, not because you have deficiency, but just like sitting for a long period of time leads to fatigue. In terms of phlegm, generally speaking, that's going to be more of like a heaviness. They feel like heavy and lethargic, and that's more of a phlegm pattern. And then blood deficiency, there's no one thing that really fits this question with the blood deficiency, but just obviously blood deficiency, the person they're pale, they're dry eyes typically, pale lips, all of that stuff. Pale is a big thing when it comes to blood deficiency. Number 3, which organ is said to be the general of the body? That, of course, is the liver. And it's the liver because the liver is responsible for planning and things like that, where sometimes people confuse that with the gallbladder. I mean, it's close, they overlap, but the gallbladder is kind of associated with specific decision-making and courage. So, I mean, the two kind of go hands in hand, but when you hear about courage or decision-making, that specifically relates to the gallbladder. And the others don't really have titles in the same sense. I mean, the heart's the emperor, but other than that, the others don't have titles in the same sense that you have to worry about. Going to number 4, what pulse would you expect for a person with Qi deficiency? So we really already hit on these. Here, weak or forceless would work for Qi deficiency. We already talked that choice A, thin and rapid, would be yin deficiency. C, slippery rapid, would be phlegm heat or damp heat. And slow relates to cold. If they just say slow, the only thing you know is that it's cold. What tongue would you expect for a person with damp heat? So that's red with a thick, greasy coat. B, pale with a slimy white coat. That would generally be pale, shows that there's, at least there's not heat. Pale, of course, usually means some kind of deficiency, but at the very least here, there's not heat, with a slimy white coat. So there you would think damp cold or something, or it could be maybe spleen Qi deficiency with damp accumulation, something like that. Choice C, pale with teeth marks, we already said was spleen Qi deficiency usually. And D, red with a peeled coat. Remember that red means heat. Peeled coating is very specific for yin deficiency. Whenever you see peeled coating, that always implies yin deficiency. Remember, yin deficiency tongues can also be described as dry and cracked and that type of thing. Okay, then in terms of headaches, a frontal headache is said to belong to Si Yang Ming, because remember the Li and the stomach channel are Yang Ming and they kind of come to the front of the head. Xiao Yang, remember, is the side, the gallbladder and the Sanjiao. Tai Yang is the back of the head, remember the occiput, so that involves the UB and the SI. and Zhui Yin is a vertex headache. Those are the ones that pretty much have headaches. None of the other yin channels really tend to come up for a type of headache, so that really pretty much completes the package. Number 7, which of the following are symptoms of yin level heat? So here, fever, worse at night, peel, tongue coating. Because remember, yin level kind of looks like yin deficiency to some degree. Remember the 4 levels. The idea is it's a pathogen that's passing from the exterior through the levels of your body into the deepest level, eventually the blood. So yin, even though it is an excess heat that's kind of making its way in, there is some overlap in terms of symptoms between yin level and yin deficiency. So just to kind of sum up the topic a little bit, choice A, simultaneous fever and chills. Whenever you have simultaneous fever and chills, that always means exterior attack. So in terms of the 4 levels, that's Wei level. So Wei level would be simultaneous fever and chills, floating pulse, and then just general symptoms of external attack. Choice C, high fever, sweating, forceful pulse. Well, I didn't include in this one the 4th of the 4 bigs, thirst, but basically choice C are just 3 of the 4 bigs. It's Qi level heat. Then D, seizures and hemorrhage. Remember, whenever you see bleeding, that's a big keynote for blood level heat. So in terms of yin versus, because Wei level and Qi level are very straightforward. Yin and blood are close, but blood level is, of course, more severe. So in both cases, they generally have a fever between yin and blood. But again, yin level, there's some overlap with yin deficiency. They'll usually say worse at night. They'll both have rashes, but a lot of times the yin level think along the lines of kind of a faint redness, where blood level like a more full-on maculopapular rash. They both have irritability and such. They both have thirst. But with mental emotional stuff, let's say, yin level will have kind of like a restless energy, where blood level will have more like delirium, manic behavior, seizures, convulsions. It's much more extreme. And of course, bleeding is the big keynote. If you see something about bleeding or hemorrhage, that's clearly blood level. And remember, tongue and pulse wise, they're both said to have a scarlet tongue, or a very deep red tongue. But again, yin level, there's some overlap with yin deficiency. The pulse is sometimes said to be thin. The tongue is sometimes said to be peeled. Whereas blood level, it won't say that. It'll just be a scarlet tongue, a forceful, rapid pulse. So keep that in mind. Then we go to number 8. If a person has insomnia, irritability, thin, rapid pulse, which of the following would be the best diagnosis? So here's a good example of just go with the tongue and pulse. Whenever you get case study questions like this, know your tongue and pulse and go with that. So what I would do is I would read this case and say, okay, thin, rapid pulse. What do I know that means? Yin deficiency. So once I know that, I can immediately rule out B, because liver qi stagnation with heat, that would be a wiry pulse, maybe wiry and rapid. D, liver blood deficiency, that would generally just be a thin pulse. It wouldn't be thin and rapid. So I can rule those out. And then I'm left with 2 choices. Okay, lung yin deficiency, heart yin deficiency. So I look to the case. Insomnia, irritability, okay, those are heart signs. You know, if it were lung yin deficiency, I'd expect to see dry cough or something to that effect. Hoarse voice. So that's essentially case studies. That's how you do it. Go to the tongue and pulse first, and then just kind of stick with that. Go to the tongue and pulse first, rule out choices that don't fit, and then let the rest of the case kind of inform you as to specifically what organ. But sometimes there's only one choice that fits based on the tongue and pulse, and that's it. That's the answer. Number 9, which of the following is a true statement? Qi is the mother of blood. So here's a good example of one where you just have to know some of these sayings. So Qi is the commander of blood, and remember, blood is the mother of yin. Number 10, which of the 6 stages is characterized by fever, sweating, abdominal pain, distension, constipation, and a forceful pulse? So that is Yang Ming bowel disease, Now, the difference here between Yang-Ming Bal and Yang-Ming Channel, remember that Yang-Ming is basically going to be the four bigs, with Yang-Ming Channel disease is basically going to be the four bigs. It's very similar to Qi level heat. Choice D, Yang-Ming Bal disease, is basically the four bigs with constipation, abdominal pain. So hence, when it's just affecting the channel, it's basically just signs and symptoms of feeling a little bit ill. When it's affecting the bowel, you still have those signs and symptoms, but it's also now causing actual organ dysfunction, so pain and constipation. Shaoyang, there's nothing to confuse that with, because that, of course, is the alternating fever and chills, wiry pulse, nausea, vomiting, bitter taste in the mouth, all that kind of stuff. As Warren would say, where else are you going to have a bitter taste? And then Taiyang, remember, is exterior. So a Taiyang attack is always simultaneous fever and chills, floating pulse, body aches, headache, that type of thing. As far as the ones not mentioned, so Tai Yin, remember that Tai Yin kind of looks like spleen yang deficiency. So it's a lot of coldness in the abdomen, watery diarrhea, fatigue, undigested food, that type of thing. Shaoyin, there's two patterns to that. There's a heat pattern, and the heat pattern kind of looks like heart yin deficiency. It's a lot of irritability and insomnia and symptoms like that. And a cold pattern, and that looks more like kidney yang deficiency. It's a lot of copious urination and coldness and whatnot. And then the Zhui Yin, you'll never confuse that one, because that's the one that has the vomiting of roundworms and the separation of yin and yang, where you have heat in the chest and cold in the abdomen. So you'll never confuse Zhui Yin from the others. Now, of course, I'm going over those quickly. It's not every detail to know, but keep in mind, again, the year ends are a multiple choice test. So, and like I said, they generally won't mix things on you. So, for example, they won't give Yang-Ming Bowel disease as one choice, then give Qi level as another, then put stomach fire as another. Usually, if they ask you about the 6 divisions, it's all 6 division stuff as choices. If they ask you about the 4 levels, it's all 4 level stuff as choices. So, they're really, if you know just some of those basics, there really shouldn't be any confusing them. The only one that they might overlap is sometimes I've seen things come up where they'll put Wei level as one choice and Tai Yang as another. And what that's getting at is, remember that the 4 levels is the school of heat disease, whereas the 6 divisions is the Shanghan Lun, it's the school of cold disease. So if they're describing a wind heat invasion, sore throat, let's say, go with Wei level. If they're describing wind cold, with say more in the way of body aches, no sore throat, floating tight pulse, go with Taiyang. Okay, so that's that. Let's go to the last of the OM questions on the practice test. So practice test 3 OM. Number 1, what would be your diagnosis for a person with cold limbs, cold abdomen, diarrhea with undigested food in the stool, and a deep, slow, forceless pulse? So the answer here is B, spleen yang deficiency. And again, the way to do this is deep, slow, forceless. So deep usually does imply yang shu, because yang wants to go to the surface. If you're yang deficient, the yin wins out and the pulse is felt at the deep level. Slow, of course, means cold, and yang shu does make you cold. And of course, forceless shows some type of qi or yang deficiency. So you kind of combine all of those, and it is qi or yang deficiency. So now this one doesn't narrow it down as much, but it at least eliminates middle jiao damp cold. And again, important to do that, because sometimes if you look at symptoms, just symptoms, cold limbs, cold abdomen, diarrhea, you might be able to reason that as being damp cold in the middle jiao. But that pulse rules that choice out. So really focus on your pulse on the test. Now, as far as kidney yang, spleen yang, or spleen and kidney yang, I kind of did this to make a point where a lot of times I find on these tests, students always pick the more inclusive answer, no matter what the actual symptoms are. The students always pick the more inclusive answer, it seems. But here, there's no symptoms of kidney, right? There's no low back pain. There's no urinary symptoms. There's no kidney symptom to hang your hat on. Just cold, that's a symptom of Yangshu. The limbs often go with the spleen. They're associated with the spleen. And then this is just diarrhea, food related. So it's only spleen. Had I included low back pain or copious urination, yeah, then you would pick spleen and kidney. But just don't automatically just pick the more inclusive answer. There always has to be at least one symptom that you can hang your hat on. And make it a solid symptom, not one of those things like fatigue. Any deficiency can have fatigue. We talked earlier how liver qi stagnation could have fatigue. So not one of those general symptoms that any number of disorders can have. Like a solid symptom, like low back pain always goes with kidney, urinary symptoms go with kidney. Then you would have something to hang your hat on here. Number 2, dealing with the emotions here, sadness is said to have what effect on the qi? So sadness dissolves the qi, makes you cry, so it dissolves the qi. As far as some of the other choices, scatters, that's fright. If you get a sudden fright, that scatters the qi. Fear descends the qi. You might remember the story about you wet your pants when you're afraid. And then worry makes qi bind. Joy, remember some of the other emotions that apply. Joy, remember, slows down the qi. And remember, anger raises the qi. Number 3, which type of qi is said to flow within the channels and the vessels? That is B, the yin qi, and we already talked about the other types of qi, so I won't go into that again. Number 4, which of the following is false in regard to essence? So C, pre-heaven essence is stored in the spleen. Remember, pre-heaven essence is the essence that you're born with, so that's stored in your kidneys. And remember, post-heaven essence comes from the spleen and the stomach, absorbing qi from the food and the water that you eat. So all of these other statements, A, deficiency of essence leads to premature aging, that's true. So going bald, premature gray hair, osteoporosis, all of that kind of stuff is said to be signs of essence deficiency. A child with essence deficiency will have delayed development, that's also true. So a child that has like the closing of the fontanelles occurs more slowly. They're slow to walk, they're slow to talk, that's all essence deficiency stuff. And then D, excessive sexual activity can damage the essence. So yeah, that amongst other things. So remember that excessive ejaculation, excessive, having given birth to a lot of children, breastfeeding for a long period of time, overtaxation, many things like that can deplete your essence over time. But you could always add to your essence by good diet, qigong, all of that kind of stuff. And then you may get some just general questions on this next topic, the 8 principles. So remember, the 8 principles is just a simple way to kind of categorize a disease. So if you ever get a case study where you're not quite sure, do an 8 principle analysis, because usually you might have trouble summing up. Like we read the case study, you may have a little trouble sometimes summing up like one pattern to fit it into. But usually it's not that hard to go, well, this looks like a deficiency, it looks like it's more cold. That's not as hard. And then once you do that, it's like, well, what is a deficiency that makes you cold? Oh, Yangshu. So, here's an example. Number 5. Which of the following would represent the correct 8 principle analysis of a person with night sweats, a thin rapid pulse, a red tongue, and a thin yellow coat? Now clearly this is describing yin deficiency, because a red tongue, thin yellow coat, and again not quite saying peeling, but thin rapid pulse, and again everything else points to yin shu. So clearly with the tongue being red, the pulse being rapid, okay, choice B here, it's definitely hot. The pulse is thin, so it's definitely deficient. Interior, well, there's no fever, chills, there's no floating pulse. Clearly this is an interior problem. The yin-yang thing is sometimes, that's more like a summary of the whole thing. So honestly with that, just if they're hot, go with yang. If they're cold, go with yin. like their actual temperature, what they feel. So if you've said this is hot, go with yang. If you've said this is cold, go with yin. So that's essentially how you would do this. You just kind of go with the tongue and pulse and get as much as you can from that. And a lot of times, again, you can get it from the tongue and pulse. Rapid tells me that it's hot. Thin tells me it's deficient. The fact that the pulse is not floating tells me that it's interior. And then I said already that if you've said hot, go with yang. So if they give you a tongue and pulse, a lot of times you can get the 8 principles just from that. But here, if you know it's yin deficiency, well, yin deficiency is somebody that we know they're hot. We know it's a deficiency. We know it's obviously an interior pattern. And then again, the yin-yang temperature thing. Don't get confused by yin deficiency thinking that's yin. Because they're yin deficient, they have kind of a yang presentation. So that's why it's yang is the answer. Number 6, which organ is said to house the po? So the lung houses the po, that's the corporeal soul. Remember, the heart houses the shen, that's just kind of your overall, shen and spirit and whatnot. So liver houses the hun, that's the ethereal soul. And remember, that's said to be responsible for what they call the coming and going of shen. The kidney houses the zhi, which is the willpower. And the spleen, which is listed here, houses the yi, which is the intellect. So that's one of the reasons that the spleen is said to be overtaxed when you have issues with overthinking and overstudying and whatnot, because it houses the intellect. Number 7, which pulse would you most expect for a person with a hemorrhage? So hemorrhage just implies, they're losing a lot of blood. It's a severe blood deficiency, so that would give you hollow. Thin, when, if hollow weren't a choice, thin works. Certainly it would be thin, but hollow just implies like really significant blood loss. And then wiry we already talked about, and floating we already talked about, that floating can be an exterior attack, but in some cases you can see it listed for yin deficiency. Number 8, which of the following would poor diet be considered? So here's an interesting topic where, it's not really that interesting, it's just one of those things that it comes up on tests and it throws people off. The answer here is miscellaneous cause of disease. Let me talk about the others. Choice A, internal cause of disease. Remember, that's always, always, always the emotions. So, stress, worry, overthinking, fear, joy, all that stuff. Those are all the internal causes of disease. External is always the weather stuff. So, wind, heat, cold, dryness, that's external. Everything else, diet, constitution, overtaxation, everything else is miscellaneous. Parasites. So this is one of those things where it's really easy, obviously. It's not a hard concept. But, it's pretty easy also to go, oh, constitutional, like that's kind of sounds internal. Overtaxation, that kind of sounds like an external. Diet, well, you took the food from out here. And so it's an easy one to kind of mess up on. And then C, Taiyang, cause of disease. I just needed a fourth choice. That's just made up. And number 9, which of the following causes coxcrow diarrhea? And that is just, there's really no explanation here. That's just spleen and kidney yang deficiency. Just a kind of, coxcrow diarrhea, remember, is the one where you wake up at 4 a.m., you run to the bathroom, and it's a very watery, cold-related kind of diarrhea. So damp heat in the LI, that's going to create more of like a burning, pussy, bloody kind of diarrhea. There's no special time of day, though. Spleen qi deficiency just causes more of a loose stool. And stomach fire doesn't necessarily affect the bowels. That's higher up. But if anything, stomach fire would probably be more likely to cause constipation and pain because the fire dries out your stool. Okay, so now what we'll do is we'll go to acupuncture, and we'll do the same thing. I'll go back to test 1, and then I'll go through all the acupuncture from the 3 tests. Okay, so number 1. What point is a crossing point for all yang channels and is therefore used to clear heat and expel wind? So that is Ju 14. Remember, all yang meridians cross there, every single one of them. Some of these other points, though, remember stomach 12, every yang meridian except for the UB crosses there. So that's one that, potentially you'll remember that that's something special and potentially could be tricky. And remember, choice B and C, spleen 6 and Ren 4, those are both crossing points for all 3 yin meridians of the leg. So spleen 6, Ren 4, and Ren 3, you could add Ren 3 here. The liver, the spleen, and the kidney meridian all cross there. Number 2, which point is located between the extensor digitorum longus and the extensor hallucis longus? So that is stomach 41. It's level with the lateral malleolus, and they do like to ask about tendons and such. So that is the one. Now I specifically put a couple of these other points because PC6 is also located between 2 tendons, but those are the tendons on the wrist, the flexor carpi radialis and palmaris longus. Flexor carpi radialis and palmaris longus. Spleen 5, not really tendon related, it's just the one that's located anterior and inferior to the medial malleolus. It's kind of right at the junction. You kind of do this kind of thing at the medial malleolus, and where your fingers meet is approximately where spleen 5 is going to be. I mean, some people will tell you not to do that, but I think it gets you pretty close. And liver 4 is found just medial, just underneath basically the tibialis anterior tendon. How many soon is it from Li6 to Li9? So that's just 6 soon, because Li6 is 3 up from the wrist and Li9 is 9 up, so there's a difference of 6. Obviously, this is just an example. They can ask about, any differences and how many soon it is between any 2 points. This is just an example, but they do ask questions like this, so it's just kind of meant to give you an idea of the types of questions they ask. Number 4, what is the location of the Jing River point of the Han Tai Yang meridian? And again, another one that's just meant to give you an example of the way they can make a question a little more difficult. But I, again, think you're pretty used to this from Gretchen. So, what is the location of the Jing River point on the Han Tai Yang meridian? So first you have to go, Han Tai Yang, so obviously the channel goes to the hand. Tai Yang, well, that's UB and SI, so Han Tai Yang is SI. And then basically this question just comes down to what is the Jing River point on the SI channel? And that is SI5, and then we have to go, well, which of these is the location of SI5? So that's B, between the styloid process of the ulna and the triquetral, or sometimes called triquetrium, bone. The other choices, though, are some actual points. So choice A, too soon up from the carpal crease between the flexor carpi radialis and palmaris longus, that's PC6. Choice C, in between the extensor pollicis longus and brevis, that's Li5. And then choice D, 7 soon up from the carpal crease between the ulna and the flexor digitorum muscle. That's not, there's no point there, but had it said 5 soon up, that would be small intestine 7. Had it said 5 soon up, that would be where you put small intestine 7. So they love to ask questions in this way because it requires you to know a lot of different things in order to answer the question. And remember, the Jing River point, out of the 5 transporting points, that's the one that you really do have to memorize. There is no rhyme or reason to its location. It's not always the 4th one up, or found at the elbow, or found at the ankle, or anything like that. It really could be anywhere between the wrist and the elbow, anywhere between the knee and the ankle. So that one really has to be memorized, where remember the other ones don't. Which of the following are all Luo points? Again, they do like to ask questions in this way. So choice A is the only one where they're all Luo points. Choice B, some of them are. I mean, lung 7 is. But Li7 is the chi cleft point. Spleen 8 is a chi cleft point. Ren 15 is a Luo. Stomach 4, choice C, stomach 40 is a Luo. PC6 is a Luo, but liver 6 is again the chi cleft point. Choice D, Sanjiao 5 is the Luo, PC6 is the Luo, but heart 4 is the Jing River point. It's not the Luo. Number 6, which channel is an internal branch that goes to the tip of the 3rd toe? That's the stomach. It does have that little extra branch that goes from stomach 36 to the tip of the 3rd toe. That way you don't leave the 3rd toe out, because remember, it's the only of your fingers and toes, it's the only one to not have a channel to start or end there. So this way it doesn't get left out. As far as some of these other channels and a couple internal branches to mention, I mean, not mentioning everything about the channels, but choice A, the spleen, remember there is an internal branch that goes to the lower surface of the tongue. GB, remember there's an internal branch that goes to the genitals and the sacrum. And the liver, remember there's an internal branch that goes up and circles the lips, goes through the eyes, and goes to 220, the vertex. Number 7, which channel has the following channel pathologies? So channel pathologies, this comes up a lot, and it's generally like this, with a list a bunch of pathologies, and you have to recognize which one's the channel, which channel it's talking about. Now, here, these questions are not that hard. A lot of times, if you just go with what's most obvious, it's correct, but you do need to remember some of the real standouts for some of these channels. So, abdominal distension, loose stool, and jaundice. I mean, loose stool we know is spleen, but jaundice might throw you off, and you might pick liver. But do remember that jaundice can be a liver or spleen pathology. So when you see the loose stool, the abdominal distension, the jaundice, you know it's spleen. Liver, you would expect to see more, you might see jaundice, but you would expect to also see it with things like vertex headache, hernia symptoms, low back pain, hypochondriac pain, possibly also mental disturbance because the liver does enter the brain. With stomach, you expect to see things like hunger, vomiting, deviation of the mouth, which is kind of an interesting one, but that's because the channel runs down like this, and sometimes febrile disease. And with the large intestine, you would of course expect to see things like constipation, abdominal pain, possibly diarrhea, but it certainly wouldn't have anything to do with jaundice. Number 8, what channel has the least amount of Qi at 1 p.m.? So you just have to basically say what channel would be most active at 1 a.m., and that's what would have the least at 1 p.m. So this is just knowing the clock. So the liver time is 1 to 3 a.m., so that means at 1 to 3 p.m. the liver would have the least amount of Qi. So this, you just have to know the clock. And you don't have to have them all memorized, you just have to know that lung is 3 to 5 a.m., and if you just kind of go in order from there, you'll be fine. Number 9, the spleen channel connects the spleen zong and the stomach flu as well as which additional organ, and that's the heart. Remember, the spleen channel does enter the heart, which is the next channel in the flow of Qi, and of course we know the heart meridian begins in the heart, so here's that connection from spleen to heart. Okay, so going to the next one, test 2, acupuncture number 1, which point is best for clearing fire according to the antique point theory. So antique point theory is the same thing as 5 shoot transporting points. I've just put the synonyms here just in case they put some of those other terms on there. So remember, the spring point is the one that's most known for clearing heat. So out of these choices, stomach 44, that's the spring point. Just as a little reminder, remember that the well point does clear heat to some degree, which is why there's no well point here as a choice. But revive consciousness is, of course, the big standout for well points. And the well points you don't really have to memorize because they're always the most distal point on the channel, the one at the corner of the nail. Then the spring points are the ones that are known for clearing heat, febrile disease. You don't really have to memorize them. They're always the second one up from the distal point, from the finger or toe. Then the shoe stream points, remember, are always the third one up, except for the gallbladder, where it's the fourth one up. Remember, GB42 is no category, it just gets skipped when you're counting. So always the third one up, except for the gallbladder, and those we tend to think of for B syndrome, heaviness or pain in the joints. Then the Jing River point, that's the one that does have to be memorized, because sometimes it's the fourth one up. So if you get asked a question and you're guessing and you're not sure, just guess the fourth one up, because there are a number of occasions where it is the fourth one up, at least if you're on a yin channel. On a yang channel, it won't be the fourth one up, because that's the source point. So at least on a yin channel, guess the fourth one up if you're not sure. On a yang channel, it could be, fifth or sixth or seventh. But the Jing River is the one that we tend to associate with respiratory problems. So imagine you have a pathogen that's working its way in. When you start to get symptoms of shortness of breath, voice issues and whatnot, weak voice, that's where you would think Jing River points. And then the Hesi is always the one that's at the knee and the elbow, and that's typically used for counterflow of qi. So like rebellious qi, diarrhea, nausea, vomiting, problems of that nature. So number 3, which point is said to brighten the eyes? So that's SI6. That's just a big standout of that point. Small intestine 6 right here. Often comes up to brighten the eyes. Then we've got oh, sorry, I'm sorry, I jumped one down. So I'll finish number 3 and go back to number 2. So stomach 25 is, of course, the front moo of the stomach. So this comes up a lot for front moo of the large intestine. So this comes up a lot for constipation, diarrhea, abdominal pain. UB67, remember, that's the big point to moxa, to turn a breached fetus. And heart 5, remember, some people remember the Jackson 5. They have a lot of rhythm, and of course they're singers. So heart 5, we think of, it benefits the tongue. So it's good for somebody with a stiff tongue where they have trouble speaking. And you can also use it to regulate the heart qi to benefit the heart rhythm. Going back, number 2, which Zhui Yin point is the best for nausea, vomiting? So Zhui Yin channels are liver and pericardium. So choice here, only 2 of them are pericardium, and PC6 is the one that often comes up for nausea, vomiting. Very common for that. As far as some other choices here, stomach 40, of course, comes up for a variety of phlegm conditions. Spleen 15, foresoon lateral to the umbilicus. It's level with stomach 25. So doesn't come up as often as stomach 25, but similar to what we said there. I'm just intestinal related. And PC8, spring point, located right here. So I'm actually at the wrong side, right here. So a big one for clearing heat. And remember with the pericardium channel, that channel they often say clear heat from the qi, nutritive, and blood levels. That phrasing comes up a lot for pericardium points to clear heat. So on PC8, you'll see that come up a lot. Number 3. No, we did number 3, so that one's set. Number 4, how many soon is it from lung 8 to lung 4? Well, here's one where you just have to kind of go, well, lung 8, that's 1 up. So from here to the elbow, so that would be 11 then. And then lung 4, well, I know that's 4 down, so that means it's 5 up. So you're just 11 plus 5, 16. So you'll get some like that where you got to do a little bit of math. All right, number 5. Which points all line up with T1? Yes, they do like these. So UB11, yes, is just underneath T1, 1.5 soon lateral. SI14, remember, is 3 soon lateral to T1, and DU13 is just under T1. And all of the others are just a little bit off. So choice A, for example, UB12 is level T2, so is UB41. Remember that the inner and outer back shu points always have a difference of 29. So 12 plus 29 equals 41. So UB12, UB41 line up with each other. UB12 is level with T2 under the spinous process of T2. So that one is out. Choice B, same kind of thing. UB11 is T1. And choice D, SI15, you could rule out because that's 2 soon lateral to C7. Number 6, how would you needle UB15? So UB15, this is just an example of a point on the ribs. I mean, I could pick any point on the ribs, on the front of the body, back of the body, doesn't matter. UB15 is just an example. So hopefully the answer is oblique. You always go oblique when you're over organs. So certainly A and C are out. And then you're left between the soon measurement, 1.5 through 5.5 to 0.7. And of course, you don't over the lungs, you would not want to go in at a depth of 1.5 soon. So it's the lesser measurement here. Number 7, which of the following is a sedating technique? So all of these are tonifying techniques except for choice C. So needling in the direction of channel flow, that's tonifying. Going against the channel flow, sedating. Closing the hole, that's tonifying. Leaving it open and letting it disperse, that's sedating. Rapid insertion, slow withdrawal, that is the one that's considered to be sedating, where slow insertion, rapid withdrawal is the one that's said to be tonifying. Alright, and then which of the following, if a person had phlegm heat in the lungs, which would represent an appropriate host-guest point combination? So host-guest, remember, is always a combo of doing the source point on one channel and the Luo point on the yin-yang paired channel, or vice versa. The Luo point on one channel and the source point on its yin-yang paired channel. So here you have excess in the lungs because they have phlegm heat in the lungs. So the idea is you would want to disperse that excess somehow. So you do the Luo point on the excess channel, the lungs, and then the source point on its yin-yang paired, the Li. So that's why it's Li4 and lung 7. Essentially, you're trying to drain that excess from the lungs and kind of disperse it to the Li meridian, get some of it out of there. So just remember, it's always going to be a source point and a Luo point on yin-yang pair channels. If you know that, a lot of times the wrong choices could just immediately be ruled out, and you don't really have to overthink like excess deficiency or anything like that. Number 9, which point is empirical for frozen shoulder? And that's just straightforward. That's stomach 38. Now, as far as some of the other choices here, stomach 37, that is, remember, the lower has C for the large intestine, so that comes up a lot for constipation, diarrhea, regulating the large intestine. Stomach 39 is the lower has C for the small intestine, so that comes up for regulating small intestine qi, and they might say for borborygmus or abdominal distension. And stomach 44 is a spring point on the stomach channel. That comes up a lot for clearing heat and particularly good for swollen gums and toothache. And number 10, which of the following organs is not entered by the kidney meridian? Remember, the kidney meridian enters its yin-yang pair, the UB, and every yin organ except for the spleen. So choice C, it does not enter the spleen. And yes. And then going to test 3, acupuncture number 1. How many soon is it from the gluteal crease to the popliteal fossa? That is 14. Know your soon measurements. The soon measurements, they come up all the time. I mean, you'll sometimes get 5-6 questions just on soon measurements, and sometimes you have to kind of combine measurements, but know these well. So, in terms of the wrong choices, of course, elbow to wrist is 12. 16, the center of the knee, or you could say popliteal fossa to the lateral malleolus, that's 16. And 18, 18 is one that sometimes people forget. It's the upper border of the pubic symphysis to the medial epicondyle of the femur. So basically the inner thigh, that's the measurement, is the 18. Number 2, what point is 1 soon posterior to spleen 9, and that's liver 7? So do remember the concept here about the spleen and the liver channel crossing, that in the lower part of the ankle, the channels from anterior to posterior are liver, spleen, kidney. But then 8 soon up, the liver channel crosses the spleen channel, and that's why liver 7 ends up being behind spleen 9. The other ones, I'll just quickly mention the location. Spleen 10, remember, is 2 soon above the superior medial corner of the patella. Liver 8, don't really worry about location because that's one where different books say different things. And kidney 9 is 5 soon above kidney 3. Number 3, cupping would be contraindicated in which of the following situations? So choice A, B, and C are exactly things you'd use cupping for. Qi stagnation, blood stagnation, B syndrome. I mean, it's a very moving technique. It's also a somewhat warming, dispersing technique, so you can use it to release the exterior and such. You can use it for cold conditions. But a very high fever, it is kind of a warming technique, and also in a very high fever, the patient might start convulsing. So cupping, remember, is contraindicated in High fevers is contraindicated in a bunch of things. Contraindicated in a high fever. It's contraindicated over edema because you would suck more fluid out of the vessels. It's contraindicated over ulcers. Contraindicated in the cases of people that have hemorrhagic disorders where they're prone to bleeding. So a lot of things is contra for, but very good for stagnation, releasing the exterior. Number 4, using 4-point needle technique. What combination would you perform for someone with a chief complaint of low appetite, loose stool, and weak pulse? So here, clearly with those combo of symptoms, the person has spleen Qi deficiency. So you have to kind of start to figure this out. You have to start out with that. They have spleen Qi deficiency. Element-wise, spleen is earth. So you can say they have earth deficiency. And then you kind of have to remember the rules of like tonifying the mother, the sedating the grandmother, blah, blah, blah. So if they have earth deficiency, you need to tonify the mother, which is fire, sedate the grandmother, which is wood. And then remember, the way you always do this is you tonify the fire point on the affected meridian, which is the spleen meridian, sedate the grandmother point, or the wood point, on the spleen meridian. Hence why choice B, tonify spleen 2, sedate spleen 1. There's 2 spleen points. Spleen 2 is the fire point, spleen 1 is the wood point. Then remember you go to the mother meridian, the fire meridian. You know, in this case it's fire, right? It changes depending on what element you're talking about. And then you do the Harari point on the fire meridian. So that's why you tonify heart 8, the fire point on the fire channel. Then you sedate the Harari point on the grandmother meridian. So hence, liver 1, you sedate the wood point on the wood channel. Now, I gave you a handout to practice that. There's always a few questions on this technique. And remember, if it's an excess condition, you always tonify the grandmother, sedate the child. Number 5, which of the following are all metal points? Again, they do like to do questions like this, so make sure that you're prepared for these kinds of questions. That's why you just need to know your big picture pretty well. So metal points are always the most distal point on yang meridians, and it's the 4th one. As far as the 5 transporting points go, it's always the 4th one up, the Jing River, on the on yin meridians. So choice B is the only one that fits here. Number 6, what is the tonification point of the liver channel? Sorry, I had to pause real quick. So what is the tonification point of the liver channel? Remember, the tonification point is always the mother point. So liver is, of course, a wood channel. So the water point on the wood channel is always the tonification point. So it's always the mother element on that channel. And the sedation point is always the child element on that channel. So if this question said, what is the sedation point? The child of wood is fire, so that would be liver 2. Number 7, which of the following is a tonification technique? And we already kind of talked about these, but a couple that we didn't talk about is A, insert on the exhale, remove on the inhale. That is a tonification technique. The opposite would be sedation. And choice D, we didn't mention. Turn clockwise is considered to be tonification. Counterclockwise is considered to be sedation. Number 8, which points are all level with the 3rd intercostal space? Again, this is something you can easily look up and check, but they do a lot of questions like this, so this is choice B. You do want to be able to figure this out. They could say what lines up with intercostal spaces, what lines up with the umbilicus, which points in the hairline all line up. So this really just comes down to knowing your point locations, and even if you couldn't, off the top of your head, just state it, could you write it out and figure out what lines up with each other? Number 9, which point treats running piglet Qi? So that's stomach 30 because that is a crossing point on the Chong meridian, and it's really one of the only points where the Deadman function actually says subdues running piglet Qi, because that is a function of the Chong meridian to treat running piglet Qi. Liver 6 is a Qi cleft point on the liver channel, so that comes up a lot for menstrual pain and pain in the genital area and such. Li15 is, of course, located on the shoulder here, so that comes up a lot for B syndrome, pain in the shoulder. And GB34, of course, is the influential point for sinews and tendons, so that comes up a lot for anything regarding musculoskeletal pain. Number 10, which extraordinary point is bled to treat high fever? And that is Ergion, tip of the ear. It's a big clear heat point, so it comes up a lot for high fever. The other points, Anmion comes up a lot for insomnia. That's kind of back here between Sanjiao 17 and GB20. It's right back in this area. Comes up a lot for insomnia. Yiming is right in that area too. It's just one soon posterior to Sanjiao 17. Yiming also comes up for sleep issues like insomnia, dream-disturbed sleep. It also comes up for like hearing and eye disorders because of its proximity to the ear and to the occipital lobe. Ergion, we already mentioned clear heat, and Xifeng, that's the one that's kind of in here. And Xifeng is kind of oddly, it's for childhood nutritional impairment or malnourished children, very specific. Number 11, which of the following points does not cool the blood? So there's only a few points that cool the blood, and most of them are located near the elbows or the knees. So UB40, spleen 10, PC3, they all do. Stomach 44, it doesn't cool the blood. Most of the ones that cool the blood are elbows and knees. And UB17, of course, does everything for blood because it's the influential point of blood. Okay, so now we'll go to the biomed portion. And again, we'll go back to test 1, and then we'll go through all the others here.